Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been really struggling since the last injection. It actually made my pain worse. I've had injections before that helped a bit, but this one was different. I don't think it was administered properly. I don't want to go back to that provider again. I think the previous one was way better.
I'm sorry to hear that the injection didn't provide relief and even worsened your symptoms. It's important that you feel comfortable with your provider. We can arrange for you to see the previous provider who you felt was more effective. Can you describe more about your current pain and how it's affecting your daily activities?
Well, the pain is mostly around my lower back and hips now. It doesn't go down my legs like sciatica or anything, but it's really intense, like sharp burning that just doesn't let up. It's worst when I'm trying to bend over or when I'm standing for a long time. Sitting for a while helps a little, but then getting up is a struggle. It's been affecting my sleep too. I just can't find a comfortable position.
That sounds very challenging. We'll need to explore some other pain management options. You mentioned earlier that you were taking Vicodin and morphine. How are those working for you currently?
The Vicodin is okay. It takes the edge off better than the morphine. Morphine makes me feel sick, gives me terrible joint pain, and just doesn't sit well with me. I'd rather stick with Vicodin for now. And about amitriptyline, I'm a bit hesitant to start new medications because of my past experiences with side effects.
Understandable. We need to make sure whatever treatment we use is tolerable and effective for you. We'll keep Vicodin as the mainstay for now, and we can revisit the idea of amitriptyline or another medication for neuropathic pain later if you're open to it. It's also important to manage your pain without exacerbating other symptoms.
I appreciate that. Also, I was supposed to get a psychiatric referral, but I don't really think that's necessary. I know my body and I know this pain is not in my head. I'm stressed, yes, but who wouldn't be with this kind of pain all the time?
Pain is indeed a physical experience, but it can be influenced by and also influence our emotional state. A psychiatrist could help manage not just potential mood symptoms, which could be contributing to an amplification of the pain, but also teach coping mechanisms for dealing with chronic pain. However, the decision is yours, and we'll respect your choice on this matter.
I'll think about it, but for now, I'd rather we just focus on the physical aspects. Can we also check on my other medications and maybe adjust them if necessary?
Of course, let's make sure all your medications are up to date and that you're not running into any shortages. You mentioned needing a refill for your stomach medication, but declining additional blood pressure medication as you have enough. We'll make sure all your prescriptions are filled properly.
Yeah, that would be helpful. Living on my own, managing all these things gets a bit much sometimes. I try to keep up with everything, but it's hard when you're in pain.
Absolutely. Managing chronic conditions and medications can be overwhelming, especially when dealing with persistent pain. Based on our discussion and your current symptoms, we will continue with the Vicodin as needed. We'll hold off on starting amitriptyline until you feel more comfortable with the idea of trying a new medication. I will refer you back to your previous pain management provider for a repeat of the pain management interventions that were previously effective. We'll schedule a follow-up in 4 weeks to evaluate the effectiveness of the pain management strategies and check on your overall well-being. At that time, we can discuss any adjustments to the plan based on your response and consider further imaging or physical therapy if necessary. Your blood pressure is stable at 130/85 mmHg, heart rate is normal at 78 BPM, and other vital signs are within normal limits. Your liver function tests show slight elevations likely related to medication use, which we'll continue to monitor. CBC and renal functions are normal. However, your CRP is elevated, which correlates with your reports of increased pain and inflammation. We should monitor this along with your ESR, which is also slightly elevated.
Thank you, doctor. It feels good to have a clear plan and to know that you're taking all my concerns seriously. It gives me some hope that we can get this pain under better control.
That's our goal. We'll work together to adjust the plan as needed to ensure you get the best possible care. I'll see you in 4 weeks unless something urgent comes up before then. Take care.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been dealing with diabetes for over 30 years now, and I must say, it hasn't been easy, especially with the dizziness and balance problems I've been having. I think it's getting worse, probably because of the neuropathy in my feet. My blood pressure hasn't been great either, which is why we adjusted those medications recently.
I understand your concerns. How have you been feeling since the adjustment in your blood pressure medications?
It's a bit better. The readings are improving, which is good, but I still feel this constant ringing in my ears. It started around the same time we changed the meds. Could there be a connection?
Ringing in the ears can be quite bothersome. We'll check into that, but it's often not directly related to blood pressure medications. You mentioned issues with your feet due to neuropathy. Can you describe what you're experiencing?
Yes, my feet are often numb, and sometimes I get this tingling sensation like they're burning. It's worst at night. Walking has become difficult, and I'm worried about falling because I can't feel the ground properly.
That sounds challenging, especially with your history of diabetes. We need to keep monitoring that closely. You also mentioned a growth in your mouth. What can you tell me about that?
Well, it's been there for about 2 years now. I noticed it hasn't gone away, and it seems to be getting bigger. I smoked for a few years when I was younger, which I know wasn't good. I'm worried it could be something serious.
It's good that you've brought this up. We've already referred you to oral surgery to get a closer look and possibly a biopsy. Switching back to your overall health, How have you been managing your diabetes, especially with your diet?
To be honest, it's been a struggle, especially around the holidays. There's always so much temptation, and sometimes I give in. I know it's not good for my blood sugar, and my last HbA1c was higher than I'd hoped.
Diet is crucial for managing diabetes, especially given your long history. We'll keep working on that. You're taking vitamin D weekly, right? How many doses do you have left?
Yes, I'm on vitamin D. I think I have a couple of weeks' supply left. Should I continue with it?
We'll review that in a moment. Let's also talk about your ear issues. Have the eardrops help with the wax blockage?
I've started using them, but there's still some ringing. No relief yet on that front.
We'll give it some more time. Earwax can take a while to clear up, and the drops should help. Now, let's go over some of your recent clinical values and our plan moving forward. Your weight is stable, which is good, but we need to keep an eye on your blood pressure, which was 127/80 mmHg during today's visit. Your fasting blood glucose is still a bit high at 180 mg/dL, and your HbA1c is 7.8%, indicating that your blood sugar has been above target. We need to address this to prevent further complications from your diabetes.
I understand. It's been tough, but I'm willing to make changes. What should we focus on?
First, continue using the blood pressure medications as we've adjusted them, and monitor your blood pressure regularly. For your diabetes, adherence to your dietary plan is essential. We'll also continue with your current insulin regimen. Regarding the growth in your mouth, follow up with the oral surgeon as scheduled.
Sounds like a plan. I'll do my best with the diet and follow up on everything else.
Great. It's important to tackle these issues step by step. We'll review everything again during your next visit, and we can adjust the plan as needed based on how things are going. Keep a close watch on your symptoms and let us know if anything changes, especially with your feet or the growth in your mouth.
Will do, doctor. Thanks for helping me keep track of all these things.
You're welcome. It's important to stay proactive about your health. See you next time, and take care until then.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
How have you been feeling since our last session? Any improvements or new challenges with your balance?
I've noticed a slight improvement, but I still feel unsteady when standing for too long. It's a bit discouraging at times.
Understandable, but every small improvement is a step forward. Today, I want to assess your mobility further to tailor your exercises better. Let's start with some balance exercises. Could you try standing on one foot for me?
Okay, I'll give it a try.
Great effort. Now let's try a walking test. I want you to walk in a straight line, placing one foot directly in front of the other. It's okay to hold on to me if you feel unsteady.
This feels challenging, but I can manage a few steps.
You're doing well, and these tests help me understand where your balance is most compromised. I'll incorporate more targeted exercises into your routine to strengthen these areas.
That sounds good. I appreciate your help and look forward to improving more.
Absolutely. With consistent practice, your balance will improve. We'll review and adjust your exercises regularly to keep making progress.
Now look at question 26.
Good morning, everyone. Thank you for joining today's session on antibiotic stewardship programs. As healthcare providers, our role in managing antibiotics responsibly is crucial. These programs aim to optimize the treatment of infections while reducing the adverse events associated with antibiotic use. By implementing these stewardship strategies, we ensure that antibiotics are used appropriately. This means selecting the right antibiotic at the right dose for the right duration. We also focus on preventing overuse and underuse, which can lead to antibiotic resistance. During our presentation, I will discuss the guidelines for prescribing, the importance of diagnostic testing, and how stewardship can significantly reduce healthcare costs and improve patient outcomes. I encourage questions as we go along, as your engagement is vital for the success of this program.
Now look at question 27.
I've reviewed your wound care regimen and noticed some areas we need to address to enhance healing. How have you been feeling about the current treatment?
Honestly, it's frustrating. The wound doesn't seem to be healing, and sometimes it's quite painful.
I understand, and that's why I want to introduce some advanced treatment options today. We can consider moisture therapy, which maintains an optimal moist environment to promote faster healing. Another option is enzymatic debridement, which involves using a topical treatment to break down dead tissue and promote healthy tissue growth.
Do these treatments hurt?
Moisture therapy is generally very comfortable. Enzymatic debridement can be a bit uncomfortable at first, but it's very effective. We'll also use pain management strategies to keep you comfortable.
Okay, if you think it will help, I'm willing to try these new methods.
I believe they will make a significant difference. We'll start with a small area and see how you respond. Your comfort and healing are my top priorities, and we'll adjust the treatment as needed.
Now look at question 28.
Welcome to our comprehensive guide on hearing aid fittings. Today we're going to explore the detailed steps involved in selecting and fitting the right hearing aids for your needs. First, we conduct an extensive hearing evaluation to determine the type and degree of hearing loss. Based on these results, we recommend specific hearing aids that suit your hearing profile and personal preferences, including style and features. The fitting process is crucial. It involves adjusting the devices to fit comfortably in your ears and programming them to enhance hearing according to your unique loss pattern. We'll also discuss maintenance tips and troubleshooting common problems. Our aim is to ensure you receive maximum benefit from your hearing aids, improving not only your ability to hear, but also your overall quality of life.
Now look at question 29.
Let's explore some effective strategies to manage your insomnia. Establishing a regular sleep routine is foundational. What time do you usually go to bed?
It varies a lot, mostly because of my job, and sometimes I just can't fall asleep even if I go to bed early.
I understand that irregular schedules can disrupt sleep patterns. It's important to try and go to bed and wake up at the same time every day. Creating a pre-sleep routine can also signal your body it's time to wind down. Maybe you could try reading or some gentle yoga.
I usually end up watching TV or using my phone, hoping I'll fall asleep.
The blue light from screens can actually keep you awake by affecting melatonin production. Let's try to replace screen time with more relaxing activities. Also, have you tried mindfulness or relaxation techniques before sleep?
Not really, but I'm willing to try anything at this point.
Perfect. I can teach you some simple techniques to start with. Managing insomnia often requires a combination of behavioral changes and sometimes medication, but we'll try the least invasive methods first.
Now look at question 30.
Today's session will cover the blood donation process and its critical role in saving lives. The first step is the donor registration, where you provide some basic personal information. Next, you'll go through a health screening to ensure it's safe for you to donate blood. During the donation, about 1 pint of blood is collected, which only takes about 10 minutes. After donating, we recommend resting for a few minutes with a snack and drink, which we provide to help you recover quickly. It's important to stay hydrated and avoid heavy lifting for the rest of the day. Remember, each donation can save up to 3 lives, so your contribution is incredibly valuable. We have a dedicated team to guide you through each step and address any concerns you may have. Let's work together to keep our community healthy.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
Our focus today will be on the management of antibiotic-resistant infections, a critical and growing issue facing healthcare systems worldwide. I'm Dr. Edward Markson, an infectious disease specialist. Today, we aim to enhance your understanding of these complex infections, discuss their impact on patient care and global health, and explore current strategies to manage and mitigate their spread effectively.
And I'm Dr. Linda Choi, a clinical microbiologist. We're particularly going to discuss practical strategies to manage these challenging infections, emphasizing a multidisciplinary approach that involves clinicians, microbiologists, pharmacists, and nursing staff. To give us a foundation for our discussion, let's delve into a case study involving a patient with a multidrug-resistant organism, or MDRO, which will highlight the typical challenges and innovative strategies required in these cases.
Absolutely, Linda. Let's consider the case of patient X, a 68-year-old male who was admitted with a severe urinary tract infection. He was initially treated with empiric antibiotics based on general practice guidelines. However, his condition failed to improve, which raised concerns about potential resistance and prompted further detailed investigations into the specific pathogens involved.
Lab results revealed the presence of an extended-spectrum beta-lactamase, ESBL, producing Escherichia coli, a bacterium resistant to multiple beta-lactam antibiotics, including penicillins, cephalosporins, and aztreonam. This case highlights not only the challenge of ESBLs, which have enzymes that hydrolyze most beta-lactam antibiotics, but also the importance of rapid diagnostic techniques that can quickly identify these enzymes, allowing for more targeted antibiotic therapy.
Exactly. Given the specific resistance pattern displayed by the pathogen, we opted for a carbapenem, which laboratory tests confirmed remained effective against the strain. This choice underscores a broader issue, the critical role of our antibiotic stewardship programs. These programs are essential not just for guiding the appropriate use of antibiotics to minimize resistance development, but also for ensuring patient safety and optimal clinical outcomes through personalized medicine.
Right. Our antibiotic stewardship team reviews ongoing cases daily, which is a best practice recommended by leading health organizations globally. In this particular scenario, they advise tailoring therapy based on the patient's specific susceptibility patterns, ensuring the optimal dosing and duration to effectively eradicate the infection while avoiding unnecessary antibiotic use. This approach not only helps in managing the patient's current condition, but also contributes to the broader fight against antibiotic resistance.
Collaboration with the microbiology lab was absolutely key in managing this case effectively. They provided timely susceptibility results, which allowed us to narrow down the therapy promptly. This rapid, targeted approach not only helps in managing the current infection more effectively, but also plays a crucial role in preventing the spread of resistant bacteria within the hospital. By integrating advanced diagnostic tools and fostering close communication between clinicians and the lab, we can ensure a more dynamic response to infections that are increasingly resistant to standard treatments.
Education plays a vital role too, particularly in a hospital setting where cross-contamination can lead to outbreaks. Educating our staff on proper hygiene practices and isolation protocols helps contain the spread of infections. For instance, our patient was placed in contact isolation until his infection was controlled, minimizing the risk to other patients and staff. Regular training sessions and updates in hospital protocols based on the latest guidelines ensure that our healthcare team is equipped to handle these challenges effectively.
Monitoring and surveillance systems are equally important. They not only track antibiotic resistance trends within the hospital, but also help in predicting and preparing for potential outbreaks. This data is vital for adjusting our antibiotic stewardship strategies and infection control protocols. It also helps us understand the effectiveness of the interventions we have implemented, allowing for continuous improvement in our approaches to managing infectious diseases.
In light of such cases, it's imperative that hospitals also engage in broader public health discussions about antibiotic resistance. This goes beyond treating individual cases and involves building a culture of awareness and proactive management across the healthcare community. By participating in public health campaigns, sharing successful strategies, and collaborating on research initiatives, we can help raise the profile of this critical issue and drive systemic changes.
Absolutely, Linda. And let's not forget the pivotal role of research. Ongoing studies into new antibiotics, alternative therapies, and innovative treatment modalities are critical at this juncture. With antibiotic resistance on the rise, the need for novel antimicrobial therapies is more urgent than ever. Research must also focus on understanding the mechanisms of resistance and how to overcome them, ensuring that we stay ahead in the fight against these complex infections.
Effectively managing antibiotic-resistant infections requires an integrated approach that involves not just antibiotic stewardship and timely lab diagnostics, but also strict infection control measures and continuous education of healthcare staff. It also necessitates a commitment to ongoing research and public health advocacy. By strengthening these pillars, we can improve patient outcomes and contribute to global efforts in controlling the spread of resistance.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Good afternoon, everyone, and welcome to today's seminar on advanced sepsis management in intensive care units. I'm Dr. Michael Thompson, an intensivist with over 15 years of experience in critical care.
And I'm Dr. Emily Richards, an infectious disease specialist. It's a pleasure to be here to discuss such a crucial and complex topic.
Absolutely, Emily. Sepsis remains one of the leading causes of mortality in ICUs worldwide. Despite advancements in medical science, early recognition and effective management are paramount. To illustrate this, let's delve into a case study that highlights the challenges and strategies in managing sepsis.
Certainly. Let's consider the case of Mr. John Smith, a 68-year-old male with a history of type 2 diabetes mellitus and hypertension. He was admitted to the emergency department with symptoms of confusion, shortness of breath, and a high fever of 39 degrees Celsius. Upon examination, he exhibited signs of hypotension and tachycardia.
Initial laboratory tests revealed elevated lactate levels, leukocytosis, and evidence of acute kidney injury. Blood cultures were taken, and broad-spectrum antibiotics were initiated. Mr. Smith was promptly admitted to the ICU for further management.
This case underscores the importance of the sepsis 3 criteria, which defines sepsis as a life-threatening organ dysfunction caused by a dysregulated host response to infection. The quick identification of organ dysfunction, such as Mr. Smith's acute kidney injury, is critical for timely intervention.
One of the first steps in managing sepsis is the early administration of antibiotics. Studies have shown that every hour of delay in antibiotic therapy increases mortality by approximately 7.6%. In Mr. Smith's case, antibiotics were administered within the first hour of recognition, aligning with the Surviving Sepsis Campaign guidelines.
Alongside antibiotic therapy, fluid resuscitation is essential to address hypotension and improve tissue perfusion. However, the type and volume of fluids must be carefully considered. Recent research suggests that a balanced crystalloid solution may be preferable to normal saline to reduce the risk of acute kidney injury.
Mr. Smith received an initial bolus of 30 milliliters per kilogram of crystalloids, as recommended. Continuous monitoring of his hemodynamic status was maintained using central venous pressure and lactate levels to guide further fluid administration.
Another critical aspect is the source control of the infection. In Mr. Smith's case, imaging studies revealed pneumonia as the source of sepsis. Early identification and appropriate intervention, such as drainage of an abscess or removal of an infected catheter, are vital components of comprehensive sepsis management.
Absolutely. Additionally, vasopressor support was initiated when Mr. Smith remained hypotensive despite adequate fluid resuscitation. Norepinephrine was chosen as the first-line vasopressor consistent with current guidelines.
Monitoring and supporting organ function is another pillar of sepsis management. Mr. Smith was closely observed for signs of respiratory failure, and mechanical ventilation was provided when necessary. Renal replacement therapy was considered due to his acute kidney injury, but fortunately, his renal function began to improve with appropriate fluid management and antibiotic therapy.
One of the challenges in managing sepsis is the prevention of long-term complications. Survivors often face issues such as muscle wasting, cognitive impairment, and reduced quality of life. Early mobilization and rehabilitation are essential to mitigate these outcomes.
Furthermore, antimicrobial stewardship is crucial to prevent the development of antibiotic resistance. While broad-spectrum antibiotics are necessary initially, de-escalation based on culture results helps in reducing unnecessary antibiotic exposure. In Mr. Smith's case, once the blood cultures identified the causative organism, antibiotic therapy was tailored accordingly.
Mr. Smith responded well to the treatment regimen. His lactate levels decreased, his blood pressure stabilized, and his organ functions began to recover. He was eventually weaned off vasopressors and mechanical ventilation, and his kidney function returned to baseline with supportive care.
This case highlights the multifaceted approach required in sepsis management. Early recognition, prompt antibiotic therapy, judicious fluid and vasopressor use, source control, and supportive care for organ dysfunction. Each component plays a critical role in improving patient outcomes.
Indeed, and it's also important to consider the role of biomarkers in sepsis. Procalcitonin levels, for example, can aid in distinguishing bacterial infections from other causes of systemic inflammation, guiding antibiotic therapy duration.
Moreover, emerging therapies and personalized medicine hold promise for the future of sepsis treatment. Genetic profiling and immunomodulatory therapies are being explored to tailor treatments to individual patient responses.
In conclusion, sepsis management requires a coordinated, evidence-based approach that integrates early detection, timely intervention, and comprehensive supportive care. Continuous research and adherence to guidelines are essential in reducing the burden of sepsis in critical care settings.
Thank you, Michael. I hope this case study provides valuable insights into the complexities of sepsis management and underscores the importance of a multidisciplinary approach in improving patient outcomes.
Thank you, Emily, and thank you to all of you for joining us today. We encourage you to stay updated with the latest guidelines and research to enhance your practice and patient care.
Absolutely. Let's continue to collaborate and share knowledge to combat sepsis effectively. Have a great day, everyone.